The Eastern Cape Health Crisis Action Coalition is demanding better healthcare in the province. It says the situation has deteriorated during the COVID-19 pandemic. This is borne out by an audit commissioned by the Provincial Health Department. The coalition is demanding an action plan from government. So let's discuss this now with Khanyisa Mapipa from Section 27, which is part of the coalition. Khanyisa, thank you so much for your time this morning. Talk to us a little bit about the situation when it comes to the Eastern Cape Provincial Health Department, saying that even during the second wave for the province was a wave that they were never going to win because of just no planning, under-resourcing, and perhaps the mismanagement of funds that would have already been allocated. But give us a picture.
Good morning, and thank you for having us. So the Eastern Cape has been in a state of decay for many years now. We as the eCAC or the Eastern Cape Health Crisis Action Coalition have been working for many years to try and help the department to, try and fix its many issues. Some of the issues that have plagued the department have been, shortages of staff, so not filling in posts, issues that include, lack of equipment, life-saving equipment such as oxygen masks, and also the facilities, various facilities not having, basic amenities like electricity and water. And we've been communicating with the department for many years now, trying to help them to fix these issues, including some issues that relate to emergency medical services. So the situation that we see with the audit report that was released by the Provincial Department of Health was inevitable, and it was something that was long coming, given the many delays and actually just ignoring the situation at hand.
Yeah, talking about ignoring, I mean, even having the now fired former health MEC Cindy Swagomba at the helm of it, being able to preside over this crucial decision making at the time. Do you think that the province or the health department in the province failed its people in being able to navigate a global pandemic that needed leadership to rise to the occasion?
No, of course, yes, definitely they failed in immense ways. I mean, if you look at the report, some of the issues that were highlighted there are issues of patient assessment, something as basic as patient assessment. It is said in the report that 26% of the patients that were or the files that were looked at, they identified that 26% of those patients had not seen a doctor in about three days, and of that 26%, 77% had gone without seeing a doctor for about 7 days. A lot of the patients were being seen by community service medical professionals without supervision, and there was obviously a lot of a shortage of nursing staff and EMS professionals or emergency medical service professionals to help patients actually get to the hospitals. So a lot of the issues that you see in the report are systemic issues that have been entrenched in the department, in the Eastern Cape Department of Health from a long time ago, which are issues that were identified not only by social justice organizations like the eCAC, but also by Chapter 9 institutions like the South African Human Rights Commission and the Public Protector. And these issues have been ignored.
You know, it's so interesting that even the research that was conducted by the Medical Research Council said that the Eastern Cape now finds itself, in terms of the death rate in the Eastern Cape, amongst the highest in the world and by far the highest in South Africa. Those are figures and statistics that we cannot take lightly. So how then do we start enforcing a change in the province, in the way in which the province is conducting its health matters?
I think something that we as the as eCAC have been trying to get the department to do for a long time is to communicate with us. You know, what the work that our member organizations do is at the grassroots level. So we work with community members, you know, who have to go to these hospitals. We understand their issues and we understand the problems at hand. And we've been very open and trying to get them to come to the table and fix the issues that we see, and we've been trying to get them to identify these issues the same way that we have been seeing them take place in our organizations, and so I think, I mean, the first thing that we would ask for is you know, transparency, and then secondly, we would ask them to take accountability, you know, of their actions or lack thereof.
Yeah. All this requires money to be able to do, right? We're talking here money in order for, you know, a department to be able to function and for hospitals to be able to function amicably and adequately. So in that case, does the Eastern Cape Health Department actually receive a budget, right? Is it a case that the budget is not a lot? Or is it the case that the budget that is received is spent to line up the pockets of officials who are supposed to be spending it on the health of the patients? So where's the money going? Is the money coming in, or is the money that is coming in actually being stolen?
So we've seen in a number of the reports that we've seen that have been conducted, like the one report that was done by the South African Human Rights Commission, in that, you know, some of the funding that is coming in for specific issues. So I'll make an example of to procure ambulances for emergency medical services. Those ambulances aren't procured, or that the money for those ambulances disappears. So there is an issue of corruption within the department. But what the department has also communicated is that they do have quite a bit of debt, in the sense of medical legal debt that they need to pay over to patients who have you know, suffered at the hands of doctors who have made mistakes, or who have you know, maimed patients or the like. So a lot of the money that they get, that comes from the Department of National Department of Health or Treasury, is then spent on medical legal payments, or goes into corruption, and very little actually gets to going into, like, funding basic healthcare in the province.
Yeah, it certainly is a travesty when we see how much of an injustice is actually being served to the patients who need the medical care. But I will leave it there for this morning. Khanyisa Mapipa, who's a health rights attorney from Section 27, we thank you for your time.